Hi friends, I am Dr. Datta. I am a surgical gastroenterologist and today I am going to talk about rectal prolapse. Rectal prolapse is a relatively uncommon condition. It is nothing but protrusion of the rectum through the anus to the outside. So before we understand the rectal prolapse, we need to know what is rectum and what is the prolapse. So rectum means it is a lowermost part or the distalmost part of the large intestine, and it is a reservoir for stool. Whenever the rectum gets filled with stool, you have the urge or the feel to defecate, that is to pass motion. Below the rectum is the anal canal. The anal canal is surrounded by muscles called the internal and the external sphincters, which actually control the defecation process. The rectum has a lot of supports around it, the fat, the ligaments, etc. And the rectum is situated in the bony pelvis. So for some reason the rectum loses its supports, or due to like chronic constipation or multiple pregnancies or aging, the musculature is weak and the supports become weak, the prolapse may happen. The prolapse is seen in all age groups, in children as well as middle-aged as well as the adult population. In children, what we commonly see is mucosal prolapse. The full thickness of the rectum doesn't prolapse, whereas only the innermost layers of the rectum, they come out in children. Today I am going to talk on adult rectal prolapse. Adult rectal prolapse, generally it is a full thickness rectal prolapse. That is, all the layers of the rectum, they come circumferentially outside or part of the circumference. So what are the symptoms of rectal prolapse? Most commonly patients come with complaint of something coming out of the anus when they pass stools. To start with, the prolapse may be very small. Majority of the time the prolapse goes inside by itself after the act of defecation. Sometimes the prolapse may not go inside. The patient has to push it with force. Some patients also have difficulty in passing motion, that is constipation. And some patients also have bleeding per rectum, or they develop ulcerations, and some patients do develop incontinence, that is the control over the stools and flatus is decreased or lost. So what are the complications of rectal prolapse? Most common is like ulceration, as I told you, ulceration, bleeding. If the prolapse is large, the prolapse rectum may not go back. It gets stuck there, and the muscles are surrounding the rectum, that is the muscles of the anal canal, may go into spasm. In such situation, the prolapse part becomes congested. It may not go inside, it starts bleeding, it becomes red, and if left untreated, if left unreduced, this may go for gangrene, that is, it may lose its blood supply and the patient may become extremely sick. So whom to consult? Many patients are shy to consult a doctor and they assume that this may rectify or correct by itself. Unfortunately, rectal prolapse doesn't correct by itself. It needs to be treated surgically. You have to consult your surgeon or a surgical gastroenterologist, and clinical examination by the surgeon is the single most important test for a patient with rectal prolapse. The surgeon would actually examine you. He would check your sphincter tone, that is the inner canal tone. He would ask you to squat and demonstrate. He would ask you to bring the prolapse, that is to make the prolapse happen. So very rarely we need some tests in the form of a colonoscopy or anal manometer, the pressure studies of the anal canal. And in some patients who have chronic constipation, especially patients who have prolapse, may also have an elongated colon. In such situation, that is the length of the colon is very redundant, it is very lengthy. In such patients, they have constipation, severe constipation. In such situations, to see if the colon is elongated or not, we order for a test called bene minima. Coming to treatment, what is the treatment? Most of the patients assume that this rectal prolapse can be treated medically. Unfortunately, the rectal prolapse is not a medical condition, it is a surgical condition. The preferred surgery for a rectal prolapse is rectopexy. Rectopexy means pulling of the rectum up inside and fixing it to the bony pelvis. With the help of a mesh or a suture. This is called as rectopexy, mesh rectopexy or suture rectopexy. The rectopexy is performed by laparoscopic method. It's called as laparoscopic rectopexy. So Laparoscopy offers several advantages to the patient because the wounds made are very small, they are very tiny, they heal very fast, the pain is very minimal after surgery, and recovery also is very fast. In some patients who have constipation, we may have to do a resection, that is the elongated large intestine, that is the sigmoid colon, the elongated sigmoid colon may have to be removed along with fixation of the rectum, that is called as resection rectopexy. And some people may also have a weakened pelvic floor muscles, so in such situations we may also have to do a pelvic floor repair. So most of the patients with incontinence improve with this treatment. So some patients, especially the elderly population who are unfit for surgery, they may have to undergo a lesser form of surgery in the form of a perineal procedure. There is a procedure done from the below, that is done around the anus. The take home message is rectal prolapse is protrusion of the rectum through the anal canal. So you have to consult a surgeon for assessment and treatment, and there is no medical treatment for rectal prolapse. Laparoscopic rectopexy is the best treatment for rectal prolapse. Thank you so much. I am Dr. Datta. I am a surgical gastroenterologist. I work in Sunshine Hospital, Gachibowli, Hyderabad. So for further queries, if you want to take an opinion, you can always call to us on 98954 37059. All the details are given in the description box below. Thank you so much.